But I would like to officially welcome you to our second session for the 3 series of Healthy Diet, Mind Diet, live demonstrations organized by Rush MS Center as part of the offerings from the Brain Health Program at Rush. And behind the scenes, and actually here on face, is Katie McGraw and Kathy Kiefer, sorry, I just swapped your names, which are going to be moderating the session behind the scenes. And we have not 3, but now 4 special guests, which makes us very proud of having so much cumulative knowledge and science and experience on brain health. On one hand, we have Jennifer Bertrelli and Laura Morris. They are the speakers for the first session, and they will continue throughout these 3 sessions. And then we also have Adrienne Castillo. She's a nurse practitioner. Adrienne also runs the Brain Health Clinic. And last but not least, we just had an addition of Tom Holland. Dr. Holland is also part of the team, and I believe he has to log out around 7 or 6:45. So if you have any questions for him, this is your time. And without further ado, I would like to pass to, I believe, Jennifer, you go first. Is that correct?
Yeah, great. I'll share our slide.
Real quick, before we jump into, I also just want to, again, make sure all of the participants are aware that as we go through the sessions to use the chat box so that we can make sure we answer any questions that come up throughout the session. Sorry, Jennifer, just wanted to make sure that was announced.
Yeah, thanks, Kathy. That's important. Okay, so I will share our slide presentation for today. As Dr. Mervale mentioned, this is our second of our Nutrition and Mind Diet cooking series. As you can see, if you did not get to join us last month, we talked about an introduction to the Mind Diet. We focused on vegetables and fruits. And I know that link is available to you all. So if you didn't get a chance to check it out yet, you will be able to. So today we're going to focus mostly on healthy proteins. We're also going to touch on healthy fats. And then Laura's going to do a demonstration for us with some hands-on food items in our protein category. So I'll begin by talking about the science with protein, and we'll revisit a tool that we introduced to you last time called the Healthy Mind Plate, the Mind Plate for meal planning. And then Laura will do some meal planning tips with her actual food demonstration. Then we're going to turn it over to Adrienne for some case review and give you all an opportunity to ask some questions. And I expect that Dr. Holland will be involved in that as well. So I just wanted to do a very quick review for those of you either who weren't at the last session or perhaps a review for those of you who were. On the Mind Diet, we highlight leafy green vegetables and other vegetables. You want to get a serving of each of those once a day. That and the berries are arguably the most important foods for health, for brain health. Berries 5 times per week. And as I mentioned, what we're going to be focusing on today is twofold, really. Unsaturated fats that come from extra virgin olive oil. We get our monounsaturated and polyunsaturated fats from this category. Also vitamin E, that's also very important for the brain. And then our plant-based sources of our healthy fats, nuts and seeds. So we want our olive oil, 2 tablespoons a day, and then nuts and seeds, about 1 ounce, 5 times a week. Then we also are going to be focusing on our lean proteins, fish and seafood. We highlighted last time that good news, we only need 1 time per week fish and seafood for brain health. You're also looking for added heart health and extra anti-inflammatory protection. 2 times a week is great. Poultry also 2 times per week is on the Mind Diet. And then next month, we'll be focusing more on healthy carbohydrates that includes whole grains, beans and legumes. And then just a reminder to keep wine in that moderation category. We're not encouraging anybody to start increasing alcohol consumption if you don't already consume. Then the moderation foods, we talked about reducing, not completely eliminating, but reducing saturated fat, trans fats, and sugars. And Dr. Mervale, I see you have your hand up. Do you want to add something?
Yes, I'm going to initiate the Q&A already now.
Great.
knowing that there is so much knowledge here in the panel. I'm going to ask a question to anyone about this recommended dose, so once a week or twice a week. Is that, I assume on average in a given time period, but that I assume is the minimum that is recommended. But is there any dose effect? Meaning, if you eat more of good things, do you get more of a benefit?
This is an excellent question, and it's actually why let's use fish and seafood as an example. This is timely because it's most of our topic today. In specifically the Mind diet studies that looked at the consumption of people who ate fish and seafood and then their cognitive health, there actually wasn't an additional benefit for brain health, for cognition, above that once weekly. So that's why we are careful not to say it's a little bit of a distinction from like the Mediterranean diet and the DASH diet that they eat at least this much, right? Like more is good. For many of the categories like vegetables, of course, we want to say the more the better, because it's not just about the brain. The brain is connected to the body and we want our whole body to be healthy. So something like that, we would say, yes, the more is better for other health outcomes as well. The reason we highlight that once per week for fish is because what we found in real life, if I'm stepping out of the research world, is that sometimes people find it difficult to get in more than once per week, or maybe they don't really love fish, and can we find it just one healthy way or fun way to cook it? But certainly it wouldn't be harmful above that level. Hopefully that answers your question.
Thank you, it did.
Jennifer, while you're on that slide, just one other quick question that came in about the veggies, even though that was last session. Could you talk about how microgreens fit into that vegetables and fruit category? Does it count as leafy greens or no?
Yeah, microgreens is one of the ones that we suspect does because it has the same nutrient profile. But if you remember, the methodology for understanding this research was that people answered questions from food frequency questionnaires, which means there was a whole list of foods, and then they reported how often they ate them and what amount they ate them. So microgreens, well, as you can imagine, is sort of more trendy and new now and wasn't, to my knowledge, on the list of those foods. So the direct answer to the question is we suspect it goes in the leafy greens category because of its high profile nutrient content, but we did not directly see that in the research. Good question. And I can't see the chat, Katie. Anything else I'm missing?
Not from my end yet. I'll raise my hand like Dr. Miravalli did if anything comes through.
Cool. Thanks. Okay, so our fats, saturated fats and trans fats and sugars are the things that we want to reduce. And again, we're not saying completely eliminate, it's all about moderation. So fried foods, we want to keep that at once a week or less. Full fat cheese, 2 times a week or less. Red meats and processed meats, 3 times a week or less. Butter, that's 1 pat, 1 teaspoon. And then sweets and sweet drinks 4 times a week. So that's a quick review there. And what we wanted to do, as I mentioned, is kind of highlight these groups of the unsaturated fats and the proteins today. And let's actually bring that a little bit closer to, what we're all doing here and learning about how this affects the condition of MS. So the reason I wanted to highlight unsaturated fats is because it's probably one of the most well-researched in this area. And the distinction here is when we look at, and this isn't just for MS, this is for brain health, this is for heart health. When we look at these research studies, the idea is I'm increasing the polyunsaturated and monounsaturated, that's just the healthy fats that we've been talking about, right? But then I'm also reducing those saturated fats. I'm making a swap. So that's this point here that I've highlighted in green is the people that were studied when they essentially swap out, when the low saturated fat intake is, when the saturated fat intake is low and the polyunsaturated fat intake is high, those were the things that are associated with positive outcomes. Specifically for MS, we saw lower levels of disability, improvement in relapse rate, and improvement in quality of life. So if you're wondering, what are those foods that may help you personally? We've highlighted a lot of them already. a lot of them do fall on the Mind diet. Walnuts, soybeans, also some seeds like flaxseed, hemp seed, chia seeds. Those are our plant-based sources. There's two different types of omega-3 fatty acids. There's more than two, but the main two are good. I like to say there's a plant-based source and an animal-based source. So your plant-based sources are listed there. And then the ones that have been specifically shown to be most effective for the brain are contained in those fatty fish. So here's my extra plug. If you're allergic, of course, we want to completely avoid it, but maybe to be a little open-minded, because we know this is one of the most powerful groups on some of the other types of fish, salmon, tuna, mackerel. We do want to remember to watch our sodium levels as well. So maybe sardines fit, again, in moderation. Those tend to be high in sodium. And then the monounsaturated fatty acids are going to be mostly from things like olive oil, almonds, also things that haven't quite made it on the Mind diet at least yet, avocados and olives. Those are all very healthy, and we would encourage you to incorporate them. So honing in then on our fish and seafood, how much do we need? Well, one serving is about 3 to 5 ounces. That's about the size of your palm without your fingers, thickness too. That's a nice way to estimate how much would be a good serving for that. The goal, again, is just once a week. You might want to double that, kick it up to twice a week if we're talking about maximal heart health protection as well. We already talked about the good nutrients and their functions and the foods contained within them. People often ask what's not included. So what's not included would be anything that would be deep fried, because of course then that would raise the saturated fat level. So the American Heart Association recommends fish 2 times a week to maximize heart health. We've already talked about that as well with some of your really great questions. And then if we're looking at protein, we also, poultry, we also want about 1 serving per week, 2 servings per week. And it's going to be the same serving size. You would just want twice is what was shown in the Mind diet studies to be associated with slower cognitive decline. And the suspicion is that it's the B vitamins, the healthy B vitamins that are contributing to that benefit. Also tryptophan, which is involved in memory and learning function. So we just want to make sure that we take off the skin on our chicken and turkey. Also ground turkey or ground chicken would be an appropriate substitution there. Again, what's not included would be something that would be fried or anything that's primarily dark meat. Sometimes we get questions about duck because that's technically poultry, but that's going to be a dark meat item. So the last thing I wanted to introduce was something called advanced glycation end products, or AGEs. So if you remember back to last month, we started to talk about this process of inflammation and how to, quote, calm the fire, okay? What things cause inflammation and then therefore can cause worsening symptoms. And so if the name of the game here for us is to calm the fire, we want to know what things can make inflammation worse. So AGEs are produced when combining high levels of sugar with protein or fat. This happens in the body in different types of conditions. So some of you may be familiar with this when you go to the doctor and you get your hemoglobin A1C tested. What that means is it's the amount of sugar that are attached to your hemoglobin or your red blood cells, okay? So that gives us an indication of how much potential inflammation there could be. And so what we want to do, again, the name of the game is to calm this fire. We want to reduce the amount of inflammation that gets put in our bodies, is look for the foods that contain the AGEs. So these are your processed foods, red meats, high sugar or packaged foods. But also, maybe some of you are familiar with this coming off of a holiday weekend. Maybe some of us were grilling outside, you know, making things, really delicious things like our burgers and ribs and hot dogs on the grill. I want to be clear, that is not a problem if we are doing it periodically, like it's a holiday, right? It becomes a problem when it becomes a habit. When I'm eating this way all the time, really high heat, something like put the barbecue sauce, the sugary barbecue sauce on the ribs, donuts because they're fried and they're coated with sugar, or something like a French fry because that's, you know, a simple carbohydrate and is deep fried. So these are the things to be thinking about. How often am I using those things? Can I reduce some of those things? And then how, when I'm cooking, and we'll get to Laura's example in a moment here, how we can reduce that process in the cooking, because this can also get produced in cooking when we're at high heat. So something like adding vitamin C or something that's acidic. So lemon juice, lime juice, a vinegar. That's why a lot of the marinades that we like will have a vinegar in it. And you can marinate meats about 30 minutes before, and then watch your heat temperature. If it has to be really high, something like a stir fry, that marination process is really good. Otherwise, you know, you can do medium or low heat, and that could reduce the production of these AGEs. So the last thing I want to remind you about before I turn it over to Laura is how to build this now. So how do I take these items and then put them on my plate and make it practical for myself? So the best thing, tip that we've talked about thus far is building your plate. This is, we call this the Mind Plate for meal planning. And the best thing we can do is build half our plate with what we talked about last week, mostly the vegetables and maybe a little bit of fruits and berries. Now we're focused in on our proteins, about a quarter of a plate or a palm, as we said, right? So we want to look for white meats. We want to take the skin off. We want to be careful with the way that we are cooking them and what we're combining with them. Next week, of course, we'll talk about the third category, which is our healthy carbohydrates. And then each time, we want to make sure that we are bringing deliciousness and enjoyment into the meal, right? What makes the delicious meal? Well, you go out and you go to a restaurant, it's sugar, it's fat, and it's salt. So how can we replicate these things? I think Laura's going to show us a lot of fun and easy ways, but in order to, we can still have fat. We just want to pay attention to the type of fat that we're having. So steer towards those healthy fats. I'm using extra virgin olive oil. I'm using avocado. Maybe I'm even using nuts and nut butters and tahini type items in my recipes. And then can we trade out some of the salt or some of the sodium that we know can also cause inflammation for other herbs and spices that may not have salt in them? Those are your best ways to get the flavor and get an enjoyable meal and also incorporate all of your mind foods for brain health. Okay, so I think I'm going to stop here. That way we can get to our demonstration.
Jennifer,
sorry, tell me if I've missed anything. Yeah.
There were a couple of questions that came through that we certainly have time built in at the end for questions, but some of these might be helpful for people to see your slides up as well as you're running through how you might respond to them. So maybe if you could respond to a couple of these now, I can read them off for you.
Yeah, absolutely.
Can making slushies or slurries of sorts reduce how the food is absorbed, say like eating berries or dark leafy greens, or does that not matter when you're preparing food?
Is the question like in a protein shake?
Yeah,
type
just
of thing, or
changing the composition of it essentially.
It really wouldn't, because at the end of the day, the absorption is going to happen, you know, in accordance with your the direct answer to the question is no. It won't change the way it's absorbed and digested.
Okay. You touched on this a little bit, but I didn't know if there was anything you wanted to add to it. For individuals that may have allergies to nuts or seafood, do you have any suggestions of how to increase the healthy fats that you talked about otherwise?
Yes, so if you can't get your healthy fats from nuts and seafoods, I would recommend then extra virgin olive oil, certainly. Also, we talked about avocado, and Laura, I think we have some items in our recipes today that you're going to be talking about. Olives, that's another one that's going to be really good. Those would be probably the three top healthy fats to incorporate.
There's one last question I think we all got about if not, you're saying not fried food, but what if someone were to sear something with extra virgin olive oil or avocado oil, which sounds like that's a good thing.
Yes, exactly. Yeah. So when we say fried, we mean deep fried. So things on the stove or searing, quick high heat is okay, and especially if you're using healthy types of oils like EVOO or avocado oil.
I think there was one last one too, and it had to do with the slide where you were talking about certain meats to avoid or yeah, proteins to
Good
avoid.
one.
And that was the deli, well, when you say deli style, if that means lunch meat.
Yeah, so I'm glad someone asked this because it would mean that if it were cut fresh, like when you go to the meat counter and they cut it fresh rather than like the packaged processed meats that they contain. So essentially like the, what did they call that? The cutting board. I forget what it
Meat slicer? You mean
was.
meat
The
slicer?
slicer.
Okay.
Isn't that called something? Laura, save me my food person.
Yeah, that's a tough one.
Meat.
Yes, the meat slicer. Fresh slice is what you're trying to say.
Fresh sliced
Yeah.
meat. Thank you, Laura. Carving board. That's what I was looking for, the carving board, but I don't think that's a marketed. I think that's a marketed name. Anyway.
Okie dokie. I think we can, sorry to cut you off there right when you're about to start, Laura. I just wanted to make sure we didn't lose a bunch of those questions in there. So turn it over to you.
Yeah, those are all great questions. Thank you. So is my screen large for everybody, or do I need to make it large?
I think if you want to make Laura's screen large, you can tap the three buttons, the three dots in her window, and then you can click the button that says move to stage, and that will make Laura's video bigger for you on your end.
Awesome. Thank you, Jen. And thank you for that presentation. That was fantastic. I'm excited for our healthy proteins today because they are super simple to get in with this MIND dietary pattern. And they're simple because, as Jen mentioned, the Mediterranean diet has several servings of fish and seafood, and it can be a little overwhelming. Whereas this dietary pattern that has been shown it benefits to the brain, it's 2 servings of poultry and 1 serving of fish a week. So that is very doable. And when it comes to planning for the MIND diet, we talked a lot about planning and scheduling in when you're going to eat your meals and having your grocery list and all of that. This is super simple because you just need to plan a couple meals with these. You, of course, can do more if you'd like, but the best way to start with this, and I'm going to start with poultry, is to plan on 1 to 2 recipes a week that you'll cook. I typically do 1 and cook a large batch and have it for a couple meals after that. And that's a great way to save time and energy, and you don't have to be in the kitchen all the time. And we're going to do one of those today. We're going to do our sweet and tangy pulled chicken. So when it comes to cooking poultry, so our turkey and chicken, there's 2 umbrellas of cooking method. There's the dry heat cooking methods and the moist heat cooking methods. So Jen touched a little bit on these a little bit. So the dry heat cooking methods are like your grilling, your sauteing or pan, getting that nice sear on it, roasting in the oven, things like that. And those are usually done over high heat, getting a good crust, things like that. Your moist heat cooking method is just what it sounds like. You're going to have a good amount of liquids in there, usually a lower heat. It's going to tenderize the meat really well. Now, which one is better? So Jen touched on this a little bit. The ones that are going to preserve the most nutrients and keep those inflammatory AGEs down are going to be those moist cooking techniques like your poaching or steaming or crock pot, Instapot, things like that. And they're going to be under low heat, which is kind of what we want to aim for most of the time. As Jen said, it's what you do most frequently. It's totally fine to have a grilled chicken breast or something like that when it's once in a while, but you don't want to be having those every single day or week. Try and have more of the cooking techniques be those low heat and moist cooking methods. So we're going to do one of those now. We're going to do our sweet and tangy pulled chicken. So I'm just going to angle my camera down here. Hi, does that look pretty good? Hi. So what we're going to start with, you can do this in an Instapot or crock pot. If you guys have one, definitely utilize it. Or if you just have a heavy bottom kind of Dutch oven, we're going to do that we're going to use that today. So that one works as well. And we're going to start with making our sauce, the things that are going to make it nice and moist and juicy. So we're going to do a sauce of low sodium soy sauce. And this recipe should be attached for everybody with the exact measurements and everything. Next, we're going to add in some pure maple syrup. So make sure you're not getting what is it? It's called like table syrup. That's brown rice, sugar, syrup, things like that. Get the pure maple syrup. It tastes better, it has more minerals in it and things like that. Next, we're going to do some tomato paste, which will give it just a really good earthy depth taste into there. And then next we're going to do some rice wine vinegar. So again, getting in that acid that Jen was talking about. And then some garlic powder. Okay. And then we're going to whisk all of these together. Okay. You can do it directly in the pot or in a separate bowl. This is a great thing you can make ahead of time if you wanted to as well. The sauce is super simple. I love it. Okay. And then next we're going to add in our chicken. So we don't need to do anything to the chicken. We're just going to add in our chicken breasts. I like thinner cuts because they're going to cook a little bit more evenly. This is boneless, skinless. It's probably just about a pound, maybe a little bit over. And we're just going to coat this in the sauce. Get it nice, everything covered here. Okay. And then if you're doing this in the Instapot or crock pot, you're just going to set it to the right amount of time. The crock pot slow cooker would be a little bit longer. The Instapot obviously is a lower amount of time. This one I'm just going to put right on the stove under low heat. So I want little bubbles coming, nothing big and rapid. I want to keep that heat low to slowly cook the meat from the outside in and not make it too chewy, right? This is very lean meat. There's not a lot of fat to distribute throughout it to keep it moist. So we want to keep it very tender. So I'm going to put a lid on that and put it over on the oven. And this one will take about 20 minutes, and I would check it halfway through and maybe shred it if it's already tenderized and then cook it for the remainder of time. So we're not going to sit here for 20 minutes while that cooks. I have some that's already cooked here. Okay. As you guys can see, make sure you can get over there pretty good. Just a couple of chicken breasts here. And I put it in a bowl, and I'm going to show you a fun little shortcut for shredding this. And you could absolutely just put this on the cutting board and get 2 forks and shred it up. Or if you have a large batch or just don't feel like making a mess, you can use a hand mixer. Okay. I know that sounds a little bit funny, but it's a great way to shred it up into tiny little bits and get that really moist chicken that we're looking for. So you want to start with very low heat. And you want your chicken still a little bit warm, because if it's cold, it's going to be a little bit harder to shred. Okay, so just that low temperature. Okay. And you've never beat chicken before. It's quite an experience. It's a little bit messy because it's a smaller bowl, but just kind of get those bigger pieces.
I can see our boys loving doing that. It's a complete opportunity to create a mess, right?
Yes, absolutely. It could be very messy. Make sure you don't have a lot of sauce in here. I kind of took the chicken out without the sauce there, but again, low speed. This is shredding up really good. Couple of pieces up there. You could do this right in your pot as well. Just make sure you're not going to get splashed. There we go. Super simple, a lot less work or mess sometimes than the cutting board. Okay, and then I'm going to take that extra sauce I had in my pot and I'm just going to pour it onto the chicken. Okay, and let it just kind of sit in there and soak up all those good juices. So again, you could do that halfway through the cooking time and then put it back on the oven to get a little bit more tender. But there we go. We have some nice, quick, so easy, sweet and tangy pulled chicken. And if you make a big batch, you have this for a couple meals. And I'm going to show you guys quickly how to make those mine plates that Jen was talking about with the shredded chicken. Do you have a question? Oh, you're clapping. Okay. Thank you. Very nice. So the first one we're going to do is a nice, simple dinner, a good, well-rounded dinner. So we're going to have our plate, our mine plate here. Okay. And we're going to start with some leafy greens on the plate. As Jen said, we're building half that plate with those vegetables. So we're going to have leafy greens. And then I had some steamed broccoli. And we're just going to put that on the side, but kind of with those leafy greens, but so we can see it. Okay. Then for my grain or my starch, I'm going to do some brown rice, some simple steamed brown rice. You can use bulgur. I love farro as well. Quinoa is a great gluten-free option. Keep it on the plate here. And then I'm going to put the chicken, the pulled chicken right on top there. And it's just going to go right over there. And I want lots of that sauce to go on there too. And again, 3 to 5 ounces, so about the size of your palm of your chicken. Okay? Now, the last thing, and the thing that Jen talked about that gives us that really good yum is the fat. We want a little bit of fat in here. So I think sliced avocado goes great on this. This is very lean. There isn't any fat in that sauce, as you saw. I'm going to add a little EVOO and lemon juice to my greens and broccoli. You could even put a little bit over that so it gets some on the chicken and rice. Where's my lemon? You could do a salad dressing, a simple EVO salad dressing, but a little squirt of lemon on there. And there we go. A nice good mine plate with our sweet and tangy pulled chicken. We got our greens, some broccoli, some rice, and the chicken. Okay, so that's one option. Another thing we can do with that pulled chicken is sandwiches. Think of like pulled pork sandwiches. We're gonna do pulled chicken sandwiches. Okay? So this one, I'm still gonna build up my plate, but I'm gonna start here with my bun. I have a whole wheat bun here if you can find them. It's a great way to get in a grain. If you don't like them, then you can do a regular white bun and just get your grains in another way, but this is a great way to get them in. And I'm gonna put in that serving of the chicken, the shredded chicken on there. Now, I made yesterday some coleslaw, some shredded coleslaw with a peanut sauce. And I'm going to put this on top of that because it's so good to have, again, pulled chicken, pulled pork sandwich or pulled chicken with some coleslaw. So this is just some cabbage, red cabbage. There's actually some whole peanuts in there, and it's with a light little peanut sauce. So I'm also getting a fat in here with the peanuts, right? A good, healthy, monounsaturated fat. Okay, so that's our sandwich. And then again, we're going to finish this plate by adding a few greens. We're getting some veggies there. With that coleslaw, I could even add a little bit more on the side if I wanted to. And a light little dressing, a little EVOO, lemon juice, whatever you'd like on there. Okay. So that's 2 different meals, both with that pulled chicken. Okay. So if there's anything that I would suggest to take away with getting in your poultry is to plan on 1 or 2 recipes a week and make a big batch and make something that you really like and that you can have for a couple meals and you look forward to. I always say, look forward to what you're going to be eating. Okay. And I'm going to quickly move on to our fish so we can get everything in here. Is there any questions on the poultry so far? We're good? Okay. So,
Laura, you make it look so easy and simple, but it's just fantastic. It's great to see an example of how all this complex science into a plate. It doesn't look that sophisticated. It looks simple, something that we can all do. So thank you for making it look like that.
oh, yes, absolutely. It should be simple, especially for our everyday eating, right? It should be things that we can really enjoy and incorporate into our life without it being overwhelming, right? That's the idea.
That's great.
Thank you. Yeah. So I'm going to talk about our fish. So as we said, it's just 1 serving a week of fish. So I know the camera's not on me, but I'll just keep it down here for now, which is super simple. and it's also the same umbrellas of cooking techniques as the poultry, right? You can have our dry or our moist. And obviously the moist, low temperature are going to help prevent those AGEs and keep the nutrient levels a little bit higher. So there's a big category of fish and seafood. This is, again, where I say pick what you like. Start with that. Don't eat something if you don't like it. And find a way to just get it in once a week. So what I'm going to do today is tuna, and I'm going to talk just quickly on the popular things that are talked about with fish and seafood consumption, and that is mercury. So I won't go into detail with this, but for some people it is a concern, and generally the bigger the fish, the higher the mercury content. So thinking of the big albacore tunas, the swordfish, the shark, all those have high levels of mercury because they've been around the longest. The fish are really large. You can reduce your mercury in your tuna by buying light tuna, yellowfin, skipjack tuna by 3 times. It has 3 times less mercury in it than the albacore tuna. Albacore tuna does have the higher omega-3, so you're kind of in that balancing act. If you eat it very frequently, maybe throw in some of that light tuna, okay? And the next thing is just our toxins and contaminants have been a subject with our seafood consumption as our oceans are getting a little bit more contaminated. And a great thing to know that most of those toxins, the PCPs and pesticides, are stored in the skin of fish. So by removing the skin, you can reduce the pesticide consumption by up to 50%. So just remove that skin before you cook it, and you've already reduced it a good amount. Okay, so I'm going to jump right into our tuna and spinach salad with olives. So this is a great one to have for a daily lunch. You can do salmon instead, or you can do that shredded chicken instead of the tuna. But today we're going to use canned tuna, and I'm going to shred up our spinach here. So I have about 2 cups of spinach. And again, I like to shred it up. As I said last week, I don't like big pieces of lettuce hanging out of my mouth. I want a nice bite size, can mix in really easily with things. Okay. The next thing I'm going to do, I'm going to move this out of the way, is add in our tuna. So I have, what is this one? This is a chunk light skipjack tuna. So again, this is going to be a little bit lower mercury than the albacore tuna. And I'm just going to add it directly in there from the can. I strained it a little bit. Okay. And I'm just going to use my fork and kind of chop it in with that spinach. That's almost like a little chopped salad here. Okay. Mixing it in. It's going to be the star of this meal. Okay. And instead of mayo, which is usually made with a lot of seed oil blends, I want to get that extra virgin olive oil in. So I'm going to put a couple tablespoons of that right on top of this salad. Okay. So I'm going to put a little bit, again, I think 2 tablespoons. If you're using salmon, you could use a little less because salmon is a little bit fattier. But the tuna, I'm going to put in 2 tablespoons, and then I'm going to put some lemon juice in there. So make sure I don't get any seeds in there. I'm just going to squirt that right on there. And that is my dressing on this tuna. It's super simple, very bright and flavorful. Okay. This is kind of my base for this salad. From here, I'm going to add in the olives, adding, as Jen said, some healthy fats in there, monounsaturated fats. If you don't like olives, don't put them on, but if you do, they're a great addition in there. And I'm going to add one other vegetable. You could add anything you like. I like the tomatoes for color, nice and bright. Okay. And then I like to add in some texture in here. So I'm going to do some pumpkin seeds, also getting you some good fats in there. You don't have to do a full serving, just a little bit for texture. And I have some dried cranberries here. We don't typically count this in the berry category, but I love that little sweet bite that you get from those. Okay, so we have almost a full complete meal here. This is great for a light lunch, very filling, but we need our carbohydrates. So I like to say you could add in some chickpeas on here, or have it with a good crusty whole grain bread. I often like to just add some crackers. I have some Triscuits here, whole wheat Triscuits, that I like to have with this salad. This is a great, easy lunch you could have daily. You know, a salad a day is really recommended on the Mind Diet, and just adding in these other brain healthy foods is a great way to get in your fish and poultry. And again, with following the lines of the poultry, I'll move it back up here. If I have a message to take home with how to get these in, is to plan on one recipe a week, one meal a week that you'll eat your seafood or fish or seafood, and make it something that you like and enjoy. And if you can, try the low moist heating cooking technique. And that is all. I think we're ready to kick it over to Adrian unless someone has any questions.
Yeah, that was excellent, Laura. Thank you again. You make it look simple, but it's great. I mean, I'm now inspired. I'm going to do it. I believe Kathy has a question.
Yeah, so there's always a lot of questions around olive oils and whether some of those big name shelf olive oils are as effective as some specialty olive oils. What's your take on that, Laura, and what would you recommend?
So I have a good little trick if you don't want to take the time to become an olive oil expert, because there is quite a lot to know about olive oil. And let me grab my bottle real quick. So this is a brand that I like to buy. I can find it everywhere.
Oh, sure. Yes.
Yeah, these are found in any grocery store. Yeah, if you've had these are great. But what I like and what you can find, I don't know if you'll be able to see this, but on the back of the bottle is this little symbol. And it is by the National Olive Oil Association. Is that right, Jen? And it certifies it that it has been passed tests to be certified in their under their umbrella of what is pure olive oil, right? Because a lot of times you will buy it and it will even say extra virgin olive oil, but it might be blends of other oils. So having that little thing on the back, and you can check your olive oils, it's probably really hard to see on here. It's a great little trick. If you don't want to, be investigating everything, is to look at that little symbol on the back there. Jen, do you have any other good little suggestions?
That's always my recommendation, is to look for the certification seals. There's a couple different ones, but you described it beautifully. They're just making sure that they're preserved, pure, and processed properly too, because then a lot of the processing with the olive oils can degrade the healthy fats and the polyphenols.
Yeah.
Excellent. I appreciate that. Thank you.
Good question.
And I believe there was a question about, is that okay to add spices or herbs or lemon into the olive oils?
Yes, absolutely. Highly recommend that. Absolutely. I flavor up the olive oil. You mean like put them right into the bottle?
Right.
Yeah. Yeah. I do that for, I'll put garlic in there and rosemary. I love flavoring the olive oils. It's a great, yeah. Someone out there is cooking. Yeah.
I know, anything you can do to avoid having to use salt, right? So get creative with spices and herbs, even pepper, that's okay. But try to eliminate the need to add salt. That was great. Thank you again.
I think, Laura, one last question before we go to Adrian. Does a pressure cooker count as moist cooking?
Yes, it does. Yeah, the pressure cooker is, I think, under like a sous vide type of style, which is that low moist heat. Yeah, that's a great one. It's actually one of the best cooking techniques for food, keeping the nutrients high. Yeah.
Perfect. Okay, well, Adrian, I'm gonna pull up your presentation and let you get started.
Hi, everyone. I like how Jennifer talked about in real life, because that's when I get to talk a lot about real life with patients. And I love that challenge. That's the best part of my job. And keeping it simple, how Dr. Miravalli and Laura both stated that complex science, but we're keeping it simple and doable. So let's talk about one of a patient that I saw in the brain health clinic. You can advance the slide. So Anne is a 33-year-old female, and she was diagnosed with MS at the age of 30. She's currently on Ocrevus since her diagnosis, and her most recent MRI of the brain shows stable MS. She complains of fatigue and fogginess every day, especially in the afternoon. And other MS symptoms include intermittent numbness and tingling of her hands and fingers. She does have a history of depression, not currently on medications, and her mood is stable, but she feels anxious at times. So her MS doctor referred her to me and the Brain Health Clinic to explore different lifestyle interventions that may improve fatigue and fogginess. You could advance this slide. So one of the first things I do in the visit is to take a lifestyle assessment. And for the sake of this case presentation, I'll just focus on some of the highlights from the nutritional assessment since we're talking about nutrition. So Anne is very busy. She's an accountant. She talked about her real life, and she skips breakfast every morning so that she makes it to work on time. She only has time for fast food at the cafeteria for lunch. And then for dinner, she's either eating frozen meals or carrying out Grubhubbing. She cooks at home one day on the weekend, and she mostly makes chicken tacos, pasta, and stir fry. So in the afternoon at work, she purchases snacks out of the vending machine. So things like chips, cookies, candies, that's specifically in the afternoon. She eats those snacks at her desk, and she stated that it just helps get her through the rest of the afternoon. She's single. At home, she eats in front of the television, watching her favorite TV shows. And she wants to lose 10 pounds. And she drinks 1 to 2 glasses of wine most nights. She states that it takes the edge off and it helps her to easily fall asleep at night. You can advance the slide. So part of my job is to look at some of the clinical data and to pull that into the information that I need to help make decisions. So her height and weight, she's 5'6" and weighs 162, which puts her BMI at 26.1, which is considered overweight. Her vital signs, blood pressure, heart rate, respiratory rate are within normal limits. I look at different lab work that she has completed in the recent past to look for any other reasons for fatigue or fogginess. So we know that her CBC is normal. So I look for anemia. Her metabolic profile was normal. Her thyroid test was normal, B12 and vitamin D all normal, as well as her A1C, which Jennifer talked about earlier. So she's not pre-diabetic or diabetic. PHQ is a screening test for depression. Since she has a history of depression, I wanted to assess any symptoms today, and she did not have any. And since she stated she had anxiety, I wanted to screen for anxiety. So I used the GAD-7 test, and she scored a 6, which shows mild anxiety. And again, we said she's busy at work, and so we know why she's having mild anxiety. You can advance the slide. One of the exercises that I like to do with patients is to just jot down certain behaviors and the pros and cons of the behaviors. The reason behind the exercise is to determine motivation for change. So we listed the behavior skipping breakfast, and she stated that it helped her to get to work on time, which she listed as a pro. But the con of it was that she was very tired and very hungry until lunch, and that throughout the morning it did seem very difficult to focus. And then getting lunch from the cafeteria every day and fast food every day. Sorry, did you just hear the train?
No.
Sorry. Dr. Miravalli, I need a new office. Thank you. So she listed the pro of having lunch in the cafeteria every day is convenience. But the con was that she chooses non-healthy food, mostly because she's starving at lunch, and it was expensive, and she did note weight gain. Snacks out of the vending machine. It helped her just transition into the afternoon. Maybe she was a little bored and needed something to eat at her desk. But the con was that it's all processed. They're not healthy snacks. Again, noting weight gain. It didn't help with her to alleviate any fatigue or fogginess. As a matter of fact, that's when she felt the fatigue and fogginess was in the afternoon. And then she feels hungry soon after eating this processed type of snack. When we talked about ordering out, the pro is that it's quick, and then cooking it herself. She's often too tired to cook after work. And again, the convenience factor was big. And the con of it is that usually she's not ordering out healthy food. It's expensive and it's contributing to weight gain as well. So the positive behavior that we discussed was cooking one meal on the weekend. And the pros to that was she identified that it helped her to relax. It was an activity that she liked to do, and she made healthier meals that cost less. She felt like she was taking care of herself. And sometimes she invited friends over after cooking to enjoy and share the meal with her. The con was that there was prep and some cleanup, and it was a little tiring. You can advance the slide. So then after completing that exercise, having clinical data and interviewing her and doing a nutritional assessment, we came up with some SMART goals. So our overall nutritional intervention was to adopt a sustainable and brain health promoting eating plan such as the MIND diet. During my visit, I provide education in regards to the MIND diet. I have handouts. We go over information, the same information that Jennifer provided for us today. And then we come up with very specific SMART goals. And that's why they're called SMART goals, is because they're very specific and personal to the patient. And often what I do is ask the patient to rate the goal once it's created on a scale of 1 to 10 in regards to how doable it is. So the closer it is to 10, then the more doable it is. So I'm not asking the patient to participate in anything that they don't think they would be successful at. So our first SMART goal, and actually every patient comes up with their own SMART goals. Everybody knows the answer to what the issues are. I just encourage that answer to come forth. So Anne came up with, I will select a green salad daily at the cafeteria, along with a piece of healthy protein such as chicken, salmon, and tofu. So that took care of the lunch issue of eating unhealthy food at the cafeteria. Her next SMART goal was, I will prepare food on the weekends and it will be enough for 3 extra meals during the week so that she can start cutting down on the amount of ordering out or frozen meals that she's eating. And Laura talked about this in her presentation is, conserve your energy and prep enough food at one time for a few meals. The next SMART goal was that she's going to snack prep on the weekend. And often I find that just constantly looking for ways to do things just a little better often opens the floodgates to doing and becoming motivated to do better all the time. So it's a little thing, the snack prepping, but it often serves to motivate to continue to eat healthy the rest of the day. How many of you grab an unhealthy snack? You were doing good all day long with eating. And then in the afternoon, you're a little vulnerable. You just take whatever's in the snack cabinet. It's often processed. And then the rest, that's your excuse to not eat healthy for the rest of the day. So what we want to do is snack prep. So for example, grab 5 plastic snack bags or whatever you use to keep your snacks in. And on a Sunday, fill those bags with your healthy snacks. So then you can just grab and go each day with your snack. Anne chose to do a variety of fresh fruit, veggies, and nuts. So on the Mind diet, 5 ounces of nuts in a week. So I said 5 1-ounce bags of nuts, and that's your snack, afternoon snack for the week. The next SMART goal was she's agreed to prepare an easy breakfast that could be made the night before, such as overnight oats or chia pudding. And I introduced her to some recipes for that. And she stated she wanted to do that 5 out of 7 nights. And the next SMART goal was to limit her alcohol to no more than 1 drink per day, which is the guideline for women. You can advance to the next slide. So I saw Anne next 1 month later, and she reported 100% compliance in meeting her SMART goals. She said they were very realistic and doable. She had subjective improvement in fatigue and cognition, especially in the afternoon. She felt more energized from healthy snacks and healthier food, and her boss even noted an increase in productivity. She was motivated and started to take a 20-minute walk after dinner 3 times a week. I didn't even ask her for that, but she just added that because she did start becoming very motivated. And then she made her meal prep weekend a very social event where her friends are helping her with the prep, the cleanup, and they did make enough food for 3 dinners during the week. She lost 5 pounds at her 1-month follow-up. Her anxiety score went from 6, which is mild anxiety, to 4, which is minimal anxiety. She attributed it to the decrease, to having more structure built into her day and to increased activity. I'd like to also add that perhaps it's her microbiome is changing and good bacteria is replacing bad bacteria and decreasing inflammation. That's what I'd like to contribute. Anne decided that she had sufficient energy to cook dinner one day during the week, and she'll continue to see me with monthly follow-ups. I did my lifestyle assessment includes assessing the 6 pillars of lifestyle medicine. So there were some improvements to be made in sleep, exercise, stress management. And so I want to continue the conversation, and when she's ready to make further changes in those areas, we work together to determine when that could happen. So as everyone knows, fatigue can be multifactorial, and it is very important to look at your lifestyle and with me to determine where improvements might make a big difference. And that's what I have for tonight. Thank you for your attention.
Wow, Adrian, that was amazing. And, I will say that the theme for today for Jennifer, Laura, and Adrian is making complex science easy to apply, right? Adrian, what you do in the clinic is truly making all this knowledge from behavioral lifestyle interventions into something that is easy. It's an algorithm that you follow with your patients. They are actually engaged in the decision of making these goals, and that will increase motivation and adherence. So, it's such a unique resource what you offer that we are very fortunate to have you in the team. And I will extend that to everyone in this panel because it's rare to find such amount of talent, knowledge, and passion for something so important that is lifestyle. So thank you for all you do. I will say, in the interest of time, we probably have to wrap things up. If there are some burning questions, you can send them on email, but also you can meet us again in a month. We have the 3rd installment of this series in a month. Kathy and Katie, when is the date for that one?
The next one is August. What is it, Katie?
12th, I believe.
August 12th. So we'll send an invitation. Thank you again, everyone that participated. Thank you for attending, for your questions. And hey, let's eat some healthy snacks. See you in a month. Thank you again.
Thank you.
Before you
Bye-bye.
totally turn off, I do love the fact that somebody in the chat box asked about a cookbook, and that it was responded that Jennifer did put in the official Mind Diet cookbook with recipes from that Laura. So they co-authored that book, and I will attest I have a copy, and it is excellent. Yes, we have one there in the office as well. So absolutely a good resource for folks. And the recipes are easy. It's not, how you pick up a recipe book sometimes that has overly complex recipes in it. I think it's really straightforward and easy for anyone. So we want to point that out.
Yeah, thank you for reminding me. And Laura and Jennifer, I believe you also offer courses and sessions. So feel free to share that information even today after with a link or in the next session so patients can actually learn more about it.
Excellent.
Thank you so much.
Thank you.
All right, have a good one.
Thanks, you too. Bye-bye.
Hey, everybody. Thanks for being here.